us know, okay, so we're recording. Many of us know someone who's men who have experienced mental and/or physical health challenges, and it's never something that we want to face ourselves. I came across an interesting statistic the other day that said that men tend to die on average 6 years earlier than women, and a large part of that is due to late detection. And another interesting fact is that over 75% of suicides are men. We also know that prostate cancer is on the rise. Latest statistics show that there's 47,500 men are diagnosed with prostate cancer globally every year, which is a staggering figure of about 129 men every day are diagnosed with this debilitating cancer. And of course, the later it gets detected, then the more danger it is for the long-term health of the man. And these numbers are alarming. And so it's important to address these sort of issues in a time when mental and physical wellness is under threat on a daily basis. Often men are too reluctant, too embarrassed to schedule regular medical examinations, but the benefit of regular screening far outweighs the 10 minutes of embarrassment that one might go through in terms of that screening process. And with early detection of prostate and testicular cancer, that cancer can be prevented, it can be cured. And so today is all about these sensitive men's health topics. It's fitting. This is what the month of November is all about on men's health. We've been urging all our male employees across the region to test, to ensure prevention, to do the early detection, because early detection is a critical element and fact in saving people's lives. So we've got a wonderful program lined up for us today. We have a panel of 3 distinguished guests. We have David Lucas, Bobby Weir, and Professor Michael Herbst, and they will all be sharing their inspirational stories and journeys with us. But most importantly, they'll be sharing special messages around the theme of prevention and protection. So we'd like to welcome these 3 gentlemen into the room, and it takes a lot of courage for them to address us on what is a very personal journey, and willing to share that with us takes courage. And we respect that and salute you, gentlemen, and thank you for your time and your participation. So my hope is that everyone will listen with an open heart, an open mind, and that as a result from what we hear today, each one of us will take a decision to take control of your own physical and mental well-being. And at this point, I'd like to also introduce and hand over to our facilitator and our MC for this afternoon. It's Cara Noble. Cara is the National Relationship Manager for CANSA, for the Cancer Association of South Africa. And she's a social worker with a master's degree in social science from the University of KZN, and she's got a passion for cancer patient support services and materials. Cara is also a mom to an almost 3-year-old, I'm told, and a 3-year-old daughter, and also very happily married. And we're thrilled to have you with us, Cara. Thank you for your time. Thank you for hosting the session, and for starting this men's health awareness conversations that we're going to be having today. So without any further ado, I'll hand over to you, Cara. Thank you very much.
Thank you so much, Paul. From CANSA side, we are just so grateful to be involved and have you guys as a partner. And I think what's been so special for us is that it's actually quite rare now that we find businesses that are willing to do something after Women's Month. We have the Women's Month programs you run, and the businesses are running up and down. When we come with men's health, unfortunately, it doesn't get as much attention, and there isn't actually enough willingness, we find, from a lot of corporates to actually focus on men. So from our side, thank you so much. We are so grateful to just be working with an organization that actually is really also positioning their men as literally so much of your workforce. It also needs this education and the opportunity to be educated. I know we've been working with your team and stand behind the scenes. It's been really wonderful. So as CANSA, we are so excited to be with you today. And hopefully, I think it seems if Paul kind of got my script as well, because a lot of what he said is actually part of my opening today. And I think that really just shows the sentiment between the two organizations and the passion for men's health and for men to be on top of their health as well. And I think one of the biggest themes that CANSA's chosen this month as part of men's health awareness is basically men supporting men. And I think that's actually where this whole thing comes together, is because men don't want to have these conversations. No one wants to speak about your prostate examination at the braai. You know what I mean? It's not lacquer. It's not nice over a drink. It's, you know, for example, you aren't feeling well, you have a lump under your arm. You know, it's not really conversational topics. And this is also why men are presenting with such late stage cancers, because men just aren't talking enough about, unfortunately, cancers. And so this is really what we're trying to encourage you today. So from the stories you're going to hear, from the guidance from Prof. Michael, we need you to encourage each other as a team, and with your brothers and your dad and your uncles. Ladies here, you have to keep on nagging. That is your full-time job. We just need you to keep nagging for as long as you can, because then eventually the guys will listen. But guys, we need you to do the work as well. We need you to encourage each other and support each other. The biggest challenge we're finding now in South Africa is just late stage presentation. And I think, as Paul said earlier, it's quite a cheesy saying, but realistically, early detection is saving lives. And that is really the bottom line. We know people that are diagnosed with early stage cancers have better treatment outcomes and have an easier journey of cancer compared to someone who's diagnosed at a late stage. And this is why early detection is so, so important. And in South Africa, a lot of people don't realize there are 5 top cancers that are affecting men. And they are prostate, colorectal cancer, lung cancer, non-Hodgkin's lymphoma, and bladder. Those are actually the 5, for example, in South Africa that are affecting the most men and actually causing the most cancer-related deaths. So at the end of the day, we just need to talk more. And I'm really proud and grateful, again, as Paul said earlier, the men we have lined up for you today, they're amazing and brave. And I really hope you can take from their stories what they've gone through, and that it will inspire you to please hopefully get tested, to encourage a family member, and as a man that's now been educated after the session, to please go and support another man that you care about and encourage them to please get screened. So just a few back of house things. We have Jacques from EP Digital. He's here today running the background, making sure everything works. We have Lucy Bologna, CANSA's head of marketing. She'll be here managing the chat box. So you won't see them, but they are here making sure everything works. Just know that due to the amount of people we have and the time space we have, we will not be answering questions directly, but if you do have any questions, please pop them in the chat box. As soon as you feel something you'd like to ask, and hopefully if we are on time, then we can go through all the questions. If not, we will actually contact our speakers afterwards with any questions that we weren't able to answer. So please don't feel like your questions won't be answered. We will definitely assist you. Just might be a few days after the webinar, and then we can assist you further. So yes, I'm very grateful to really introduce you guys to this fantastic panel. I'm going to start first with David Lucas. He is a fantastic gentleman. He is one of our leader volunteers, and really does so much of support for CANSA in terms of our prostate cancer awareness. He's been on webinars and radio, and he is always up for a TV. He always wants to talk about his prostate and how he is, and he wants guys to know what is happening. And that is why when I was explaining him to Stan, I was like, this guy's just got something. He is so open and honest, and he takes a scary thing and makes it not scary. He is the tender age of 64. He is a retired school principal, so likes being very organized. He has 3 children and 4 grandchildren, semi-retired, but literally very busy with cancer. He's also recently a Global Hero of Hope, which are a certain amount of South Africans that were nominated through the American Cancer Society as being leaders and pillars of strength in their community for representing cancer patients. And David was recently named as one of those for cancer. So we are so proud of him. He is very passionate about making men feel more comfortable and making men realize that they can live a life after prostate cancer. David, welcome. Oh, you're muted, David. Sorry.
All right, let's go back there. Paul, thank you for calling me a no, you called me distinguished. Cara calls me a gentleman. And here I am, only one person who wants to say, I want to help somebody else and save their lives. But I want you to take note that every single person in DHL needs to listen. Because if you look at my name, my second name is Hayden, David Hayden Lucas. Guess what's my initials? So guess who's the boss? So you better be listening to me, otherwise there's going to be big trouble here. And I'm not speaking to you from South Africa, I'm speaking to you from the States. So please, you've got to listen to me. Thank you.
Oh, David, can you believe it? DHL, that's hysterical. Actually, oh, that's so clever, and that wasn't planned. Okay, so David, could you share with everyone, and I think this is probably one of the most common questions, is what happened? What did you feel? How did you end up finding out that you had prostate cancer?
Guys, you know, this is the and I want to call it sort of the absolute life changer for me. I did not feel anything that is supposed to be associated with prostate cancer. I did not have any sign that said to me that, you know, which normally is you find it difficult to urinate, you find the sensation of you want to keep on going to the toilet, just nothing. You know what, I by chance went to the doctor, and the chance was that I felt that I have arthritis. And I had this long discussion with my doctor because he's a friend of mine, and we obviously were having a chat, and he said to me, "You're talking rubbish, you don't have arthritis." And I said to him, "You know, I feel that you should just treat me." And he said to me, "David, I am going to ensure that, and I'm going to prove you wrong, I'm going to take bloods." This is 2011. I'm already over the age. I was 53 then. I was in the age where I should have been going for regular checkups once a year. But in 2008, I decided this is nonsense. Nothing is going to happen. Like most men, you know what? Do I have to really care about myself? It's not important. There are other better things to do. And to cut a long story short, Mohammed took bloods from me. And he phoned me a couple of days later and said to me, "You know what? You now do not have arthritis, you've got gout." And guys, it's not because I've been drinking a lot of beer, and it's not because of all red meat, which I'm still consuming, but it is purely because you now have a raised PSA level. Now, what does that mean? It is the prostate-specific antigen. An antigen, it's a marker that's found in the prostate. And Mohammed, and I want you to take note of this, he only took bloods. And when that blood came back, that gave him an indication of what is going on. I was referred to a urologist who then took me for a biopsy, which means I went in the morning, the guy took under anesthetic, they took a piece out of the prostate, and he said to me, "David, come back to me in 2 weeks. If there is anything wrong, I will phone you before the time." 2 weeks later, nothing had happened. And guess, I mean, why should I be worried? There's nothing that's going wrong. I then decided, let me take my walk to the doctor. And as I walked in, he said to me, "Please sit down." He says, "You know what, I've been trying to get a hold of you. There is a problem. You have cancer. You have cancer." 3 words. Dreaded words that so many people hear. And what they do is they think that's the end of life. That is only the start of, for me, a beautiful journey. A journey which I could find myself, a journey I could find other people, and a journey in which I believe what I'm doing is what God has been wanting me to do all along. It is a journey which is fulfilling. And I want to say it to you today, that cancer patients are God's favorites. God gives them a time to make right with Him, whoever you believe Him to be. Make right with Him, make right with community members, make right with your family, and make right with yourself. You will have the opportunity to meet those fantastic and grateful people They're great people that sit for arguments that they get cancer or wants to hear your story. And most of them are actually cancer survivors as well. And they want to assist you. Thank you.
Thank you so much, David. And I think that's actually one of the biggest misconceptions we have, is that there's a lot of fear around technically the digital rectal examination, and the fact that a lot of men think that that is the only way to check for prostate cancer is obviously the doctor, as sweetly as I can say, doing a butt examination with the finger. And a lot of men are quite stressed about this. But the reality is that it's not your first port of call. A blood test is the first port of call. And as David said as well, if you're having from the age of 45 annual blood tests for your PSA, when you're having your cholesterol, blood pressure, etc., it actually should form part of your annual checks from the age of 45. But a webinar last week where one of the urologists said that if you have prostate cancer in your family, if it's your dad or your uncle, direct line, you could start as young as 40 if it's in your family, as an awareness, just because of the risk that you have. And that's a bit of a higher one if it is your direct family. So David, another question I think, and that's something that people ask us probably so often, is how did you tell your family about your diagnosis? What was that like for you? Coming home, you've had this conversation, and now you've got to tell everyone else. How is that for you?
Guys, I think, when you've had that technically death sentence being passed over you, how do you deal with it? Do you keep it to yourself? It takes the guts to go there and say, guys, I have cancer. Thank God my family rallied around me. Because remember now, guys, I have not been completely diagnosed. The doctor says I have cancer. But this is not the end of the world. Now the treatment starts. Now I realize how close my family were to me, how close they could be to me. And I always want to make a point of this and say to people, if you have somebody in your family that has cancer, please just understand, sometimes they don't want to speak about it. But when they do, just be there to be the ear. Because that's what my family did for me. They were the ear. Because I can tell you, you do wake up at 2 o'clock in the morning and you sort of say, hey, you know what, I'm dying. My friend, we all are going to die. But I have an opportunity to meet and feel the love that they have. And I promise you, you will be rest assured that you've got people within your family, your partner, your children, your friends. I'm fortunate I've still got a mother and father alive that showed me the love that they did. But breaking that news took a bit from me. And the one advantage is that I want us to live past that stigma that is often attached to cancer. It is not something that you've done wrong. It is a natural disease that can occur. It is something that can happen to you. It can happen to me. And I can assure you that your family members, your partners are there. They want to assist you. They want to be with you. I see on the screen of the flash of my one son, my eldest son. And it was so great when one day at the cancer, he was the MC and he stood up and said, my greatest hero is in this room. And I promise you, you are the hero of somebody. Unless you are going to neglect to have yourself, to have early testing. Because if you have early testing, you're going to have, like me, 10 years later. 10 years later, I'm still here. And I promise you, I would not have been here if it wasn't for the support of my family, but also the treatment that I received, which on its own, I think Cara would want to take back from me, but the treatment is actually fairly simple. Again, if it is caught early enough.
No, definitely. And I think, David, just to end off, I think, what is you have stood here and there, but I think, what is the message you have for the guys here? What is your closing message that you would like every man to walk away with? The most important thing that they can remember.
Guys, I want you to stand back, and there's the two elephants in the room. We addressed the one, which is the digital examination. And I'm brazen about it. I talk about it all the time. The second one is men fear that if I'm diagnosed with prostate cancer, how is it going to affect my sexuality or my sexual performance? My dear friend, 64 years of age, I'm saying to you, it doesn't have to affect you. I know I'm still active. I do not have to fear that. I want you to remember, and that is my message to you. If you have early detection and on a regular basis after the age of 45, you go for your examinations, it will be picked up early.
I'm so sorry. I think we unfortunately lost David there in a lovely mid-passionate end. Yeah, can't see him coming back. Okay, if he comes back on, I will hopefully give him a chance to say his last closing words. But I think a very powerful speech. David, can you hear us? I think it's completely dropped off. I think David. Am I word? Okay, yeah, he's dropped off. So yeah, I think from David's side, a very passionate person and someone that has really looked at his cancer journey, and instead of looking at it as possibly as a negative side, he literally uses it every day to inspire others. And yeah, it's actually part of his life's work now. It's actually impacting others and really making a difference. So we are so proud of David and all that he does. And I will tell him after this because he obviously can't hear us speak. But thank you so much. I think now we're going to move on to Professor Michael Herbst. Now, Professor Michael Herbst actually works for CANSA, and he's been with us for many years. I think it must be just over 15 or more. And he's a clinical specialist and a patient advocate. He is an author and co-author of a large number of scientific papers in accredited peer-reviewed journals and various books. He is a health specialist at CANSA, and he's actually researched and authored over 300 fact sheets on various cancers and topics. He's actually a recognized medical ethicist, sits on quite a few other boards, etc., as a consultant. And yeah, he's a very well-known person. A lot of people might recognize him from TV, especially in South Africa. He is regularly on TV from SABC to Health Talk, E! News, ETV as well. So yeah, he does the rounds, and he has a really great opinion on things. He's extremely well educated. And despite all of that, he's also actually part of our telecounseling team at CANSA. And he's been doing counseling for men and women actually with cancer for years, actually assisting with their clinical queries. And I think from a clinical side, sometimes a lot of confusion, patients not really understanding what a treatment protocol is, etc. So Prof. Michael is that go-to guy for us at CANSA and does incredible support services. And as a man, he is very passionate really about men's cancers and putting it out there and actually giving men an opportunity to share. And that's why he was the perfect person to have on this panel as we discuss men and men's health and what men go through. Welcome, Prof. Sorry, Prof, you're on mute. Yes, there you go.
Thank you very much for those kind words. And then I would like to welcome and say hi to the other persons who are also co-presenters, and in alphabetical order, Bobby, David, Paul, thank you very, very much for your participation. And I've been asked to talk to you more about the mental health side, as well as how to, because that touches onto mental health, how to care for a friend who has been diagnosed. And that falls more on my side as a patient advocate. Now, there was very interesting research done quite recently, and this showed that fear, as well as a fear, which is a different type of fear, of mental health issues. So the mental health issues plus a fear of a diagnosis, a fear of the possible outcome of the diagnosis, a fear of treatment, that those two work together and is a major cause that men fail to seek health early. Because men who experience those type of emotions, they see this as a failure, and it becomes a mental health issue for them. And that is why they won't go out and talk. You know, cowboys don't cry. The men are hunters. They cannot be hunted. You know, all these myths that we have surrounding ourselves, and men find it therefore very, very difficult to talk about it. Bring them together around a barbecue or a braai and have a beer or two with them, although I fortunately don't drink, but have a beer or two, and you can hear them talk, and they don't care what they talk about, and they can joke about anything in their body right down to below the belt. But the moment that it comes closer to them personally, they just close up completely. Fear, and they see this as a mental health issue, because I am failing myself. I am a failure to my friends, to my family, to my wife, to my life partner, or whoever the case may be. And this leads to one of the important leading aspects to men not seeking health assistance. That is really very, very important. I then want to really spend my next 10 minutes that I have at my disposal and really talk to you, and it'll touch on some of the other questions that I've been asked to talk about. How to take care, or how to approach a friend, a male friend that has been diagnosed with cancer. It's very, very important that we should have our own feelings in hand. Do you know, the other evening I was watching the ENCA Afrikaans news, and they announced the death of quite a well-known Afrikaans singer. And they then had an interview of several people who were bringing honor to him as well. And my heart broke that they had the audacity to show the face and this crying man, Bobby van Jaarsveld, on the television screen, crying his heart out because of this very dear friend of his that had passed on. I think it's so cruel that I just can't imagine that anybody would be prepared to do that. And that brings me to this thought. Be prepared yourself. What is your relationship with a person that you are going to talk to about his diagnosis, about his experiences, or whatever? That you have this already worked out, that you don't become emotional, that should your friend become emotional, that it will not affect you, that you are prepared that this may happen. So come prepared beforehand, that you know exactly how to deal with it. Then, very, very important, learn about the diagnosis. But be very careful, don't use Dr. Google, because I think it's one of the most dangerous doctors on the planet. Because yes, there's a lot of valuable and valid information on Dr. Google, but there's such a lot of myths and disinformation. Please be very careful when you access any websites to find out about a diagnosis, what the outcomes could possibly be, what the side effects of treatment, etc., etc. Become well prepared, so at least you can be knowledgeable about the issue that you are talking to your friend about. I mean, if this friend of yours has got, say, prostate cancer, but the only cancer that you really know about is because you had a friend previously who was diagnosed with a lung cancer. So you only really know something about lung cancer. Know exactly what the diagnosis is so that you can talk with authority and that you don't make a fool of yourself. Then, whatever is said during the conversation is personal, is private, and is only between the two of you. You do not share this information with anybody else. If you need to have a debriefing session afterwards, because I find it very, very often that after having a tele-counseling or a personal face-to-face counseling, that I am really emotionally drained. If you need a debriefing yourself, have a debriefing with somebody who's qualified to do it without the mention of any names, so that you do not share information of a personal nature. So be very careful about this. And then at the same time, always be ready to see things from the perspective of the person that you're talking to. I may have my own cultural background, my own education, my own learning, my own population group that I come from, my own cultural group, my own ethnic group, etc. But always be prepared to see it from the perspective of the person that you're talking to. Then be prepared. You may not have seen, if it's a friend, you may not have seen this friend for a few weeks or a few months. You only now hear that the friend has got cancer and you're now going to visit him, or you're going to have a Zoom meeting or a Teams meeting or a face-to-face meeting on your smartphone. Be prepared for a change in appearance of this friend of yours. He could show his severe fatigue, weight loss, hair loss, or any other changes in his physical appearance. And do not comment on those. He will be aware of that his features have changed, that he now looks 50 years older than he did 2 months ago. So be careful not to show reaction, especially a negative reaction to any physical changes that has taken place in your friend. What is very important, and please remember that I'm not putting these things in a specific order. The one is not really important more than the other. Ask always for permission. If you want to talk to him about his disease, talk to him and say to him, look, it's okay, I really want to visit or chat with you about your health problem. Is it okay with you that you talk about it? And he will then quickly say to you, I'm not ready and prepared yet to talk about it. Respect that. And say to him, look, I'm always there. If you feel that you're ready to chat, let me know. But don't stop contacting him. Contact him still in between until he says to you, I am ready to talk about my illness. Because you must remember that there are very many stages that people go through once they hear cancer diagnosis. And I think one of the very important ones is the study done by Dr. Kubler-Ross. She describes very carefully and in accurate terms the different stages, from denial to anger. Why me? Why not somebody else? They want to bargain and say, dear God, you know, if you make me better, I promise not to do this again, or I will rather go and do that. They make severe depression that they can go through, and eventually, hopefully, acceptance of their condition, and make provision in your chatting to your friend that he can go through all those stages. So don't when he attacks you or you feel that you're being attacked, if he's still angry about his diagnosis. He's not angry at you. He's most probably angry at himself. He may have been a smoker and he's got lung cancer. And he's now angry at himself for not heeding the messages. Rather give up your tobacco, seek help. So keep that in mind. Be flexible. It is very, very important. Because remember that you spoke to your friend 2 days ago. You made arrangements that you will phone him again today. And you phone him and he tells you, I don't want to talk to you today. Be flexible. Understand, we don't know what has happened in the last 2 days, why he's reacting like this. So we've got to be prepared and be flexible to accept a change in behavior. Then remember, there's nothing wrong in laughing together. If something is said, remember that you can laugh about it. And this may be very good medicine for your friend, that he can hear the humor, or that you're experiencing something humorous in what has been said. And there's nothing wrong in that. Then always check in. It is so important that you don't just pitch, that you don't just phone. Make an appointment, check in and say, look, we were planning to chat at 3 o'clock this afternoon. Is it okay if I still phone at 3 o'clock? We don't know, maybe he's turned into a bit of a problem phase of his illness and he's had to rush off to the doctor and he doesn't want to talk now. So just check in and make sure. can I still phone you at 3 o'clock? Then it's important to always offer help. People are afraid to ask for help. They don't want to be a nuisance to anybody else. But added to that, if you have offered any help or assistance, it is so important that you follow through. A disappointment to somebody who's been diagnosed with cancer. You promised, I will come and phone you at 3 o'clock, or I will visit you such and such a day, such and such a time to take your script to the pharmacy. Do not fail them. Follow through on any promise that you've made. If you do not follow up and follow through, you'll lose confidence, or that your friend will lose confidence in you and will not trust you afterwards. Treat them the same. The mere fact that he has now been diagnosed with cancer doesn't make him a different person. This is why I get so upset when I, still nowadays, in this enlightened age that we live in, I come in a parking lot and it says disabled parking. I mean, how can we say that? It is a parking for individuals with disabilities. There's a difference in what we say and how we do it. Remember, you're not talking to a cancer patient. You're not talking to a cancer friend. You are talking to a friend who has been unfortunate to be diagnosed with cancer. And our approach that we have is so important and very, very important for them. And always treat them the same, like you always did. If you called him by a nickname, don't all of a sudden today use his full name. He's still that same friend that you knew all along, and treat him all the same. Also remember that it is fine and okay and maybe very good to talk about other topics than cancer. Don't just talk cancer. The conversation may become so negative and so stressful that your friend may be worse off after your conversation than before the conversation. So still talk about the good times that you had together, of the last time you went to the coast together, of the last time you had a party and the beautiful friendship that you have. Do not fear that. Then lastly, before I give you my take-home message, is the following. If you'd have a chance to prepare, I think one of the best ways to prepare to talk to this friend of yours, and unfortunately I don't fall in that category because I don't Twitter, tweet, or Facebook or anything. And that is bad because it helps so much if you know that your friend has been diagnosed with cancer and you can go onto his Facebook, because this is the place where people very often will share those subtle thoughts of themselves, of their inner self, and that you can pick that up in a Facebook or in the things that they've said in a blog and use that as background, and you know what will be the good things to rather say, and instead of saying something negative. Then, Cara, my take-home message to everybody is, and it has been said, it's been mentioned by David, talking about an early diagnosis, early treatment. I want to say as a take-home message, whatever is different in your body today than it was yesterday, last week, last month, or last year, have that seen to. The earlier, the better, because that can lead to early diagnosis, early treatment, and your life can be saved. Remember, you are responsible for your own health. And there are at least one person, I'm sure, in your life who would want you to be around for as long as possible. And in respect for that person, take responsibility for your health, go for your consultation, early diagnosis, early treatment, and remission may be ahead. Thank you very much, Carla.
Thank you so much, Prof. Wow, I think so much goes into it, and I think it's definitely a very commonly asked question, and I think people always want to know how to support someone they care about. I think a lot of people don't even actually know where to start. I think the most important thing you did say is that it's still your same friend. It's still the same person. They're just in a bit of a rough patch. They're just going through a hard time, but they still need you, especially the flexibility thing you said. one of the biggest things patients tell us is that they actually lose a lot of their friends because people are frustrated. Oh, he cancels on me, doesn't reply to my messages. He's just in his own mission. And I think it's really hard. Men are going through a very hard time. And so keep on going, keep on checking in, be kind. You do not have to be a cancer expert in any way. You just have to have a good heart, be kind and be patient, and let that person know that you are still there and that you actually still care. Thank you so much, Prof, for your message. I think something that we're actually so proud about is our Men Supporting Men support group. We're actually launching it on Saturday. So it doesn't matter where you are, if you're in South Africa or abroad, like many of you are, we'd love you to join us via Zoom. It's actually like no woman allowed. So you won't see me or any of our social work team there. We have the wonderful men like David, who's been a lead there. Prof and Bobby are actually all part of the committee. We have 5 other fantastic men as well, and they're helping us actually have these sessions monthly for any man that has cancer, so that he can have a space with men, just a whole lot of guys coming together, sharing and talking. And I think the whole point is that let's actually get men talking in a safe space. So if you know anyone who would like more information, please let us know. We'll send that information to you. But yes, it's definitely time that men start having a safe place to come together. So thank you so much, Prof, for your help and for sharing with us today. Thank you so much. I'm now going to hand you over to the wonderful Bobby Wurr. He is actually a breast cancer survivor, a true gentleman, and married to a fantastic wife, Linda, who's actually also a dedicated cancer volunteer. Bobby actually works in the Cancer TLC service. It's called the Cancer Tough Living with Cancer Children service. And he's actually the coordinator for Polokwane. And he is working very hard every day at St. Petersburg Hospital, offering services, support groups for parents, doing a lot of community education, a lot of counseling, etc. So despite his diagnosis, again, another man that's very active in his role of empowering and educating and trying to make the lives of those parents with a child with cancer just a little bit easier. So I'm very proud to introduce you to such an incredible man. He is also a patient advocate. So we know sometimes in certain sectors, and especially in his province, patients are coming to him all the time with challenges. There's medicine shortages, there's treatment problems, and Bobby is always advocating. He goes through to our advocacy department and he toys and writes letters, and he's really so passionate about patient rights, and he always goes the extra mile. So I'm really, really proud to introduce you to the fantastic Bobby Wurr. Welcome, Bobby.
Thank you very much, Cora. And yeah, geez, you've really gone over the top.
No, I don't talk nonsense, Bobby. So I think if we could just start, I would like to ask, and I think it's the question we always ask first, is how did you find out that you had breast cancer? And I think this is something that probably a lot of the guys or girls are obviously just very interested to know about. So please share with us.
I was having a bath one evening a year or two before, which would have been about 2007, somewhere there. And I felt a tiny pea-sized lump next to my nipple. And I jokingly said to my wife, oh, this is cancer. And thought nothing more of it because it wasn't painful. And, this is something that's seriously, in my mind, underrated. We don't tell people that cancer, when it starts, it's not painful. What Prof said earlier about checking on a regular basis anything that's not right or not normal, sorry, it is important because we tend to laugh it off. It's not painful, it's not bothering me. And this is what I did. And in 2008, December, my wife went for her checkup. And she said to me, come with, and men being men, we don't do the doctor thing, we just don't. And so she went in, and then she said, would I let her know when I was ready to collect her? And I popped into the doctor's office just to say I'm outside. And she said, let the doctor have a quick look at your breast, your nipple, which by this time had become inverted. It was oozing. And it was beginning to be painful. And the doctor took one look at that and she said, that is cancer. And I was really annoyed because there was no test. She just looked at it. Anyway, she booked me an appointment with a specialist for early January, and I went. I had a mastectomy. I don't do the needle thing. I'm petrified of it. So they didn't do an aspiration. Instead, when I was on the operating table, he checked there, and they found that the cancer had moved to the lymph nodes under the arm. And so they obviously had to take that out. And when I came round, I felt 2 drain points. And then I realized that it was cancer, and an absolute peace came over me after that. I just knew, all right, fine, this is it. We're going with it. And we were in the flow, so we had to do it.
Wow, that's
Yeah.
incredible. And I think something that really stands out for me is that we actually have women that come to us in the same situation, where people are having visible symptoms, you're visibly uncomfortable, but it's still so hard for you to actually go. Why do you think that despite that uncomfortable, the oozing, etc., why do you think you still didn't go? What held you back?
It'll never happen to me. This is sort of just, I find it so often when I speak with people that we say, you know what, it's not going to happen to me. I must tell you, I did speak to a friend of mine at one stage, and I said to him, I've got a lump here and it's oozing. And he said to me, you know what, it's probably just a sweat gland or something like that that's infected. And, we tend to take the word of a friend over the word of a doctor.
Yeah.
So I left it. But I was really, really lucky. I mean, I have the most wonderful wife in the world. Really, I do. And Linda stood by me the whole way through. Our mind is a powerful thing. And I remember the worst part for me was the days I had to go for treatment. And as I say, I don't do the needle thing. So I had a port put in, and on the morning of treatment, they would give me a whole lot of shut-up pills so that I'd be in a floating state. But even then I would fight. And as I say, my wife is wonderful. But on the morning when I would go for treatment and she would wake me up, I hated her with anything and everything that's in me. And I can't tell you why, because she's wonderful. She's excellent. She's everything. But just the mind on those days was bad news. But yeah, I did it. I did the chemo, I did the radiation, I did the tamoxifen. And I'm so blessed. At the time, I said it was a year in my life that didn't exist. But looking back, it was the best year, the greatest blessing. It opened up doors for me that I never thought would be there, and has enabled me to help other people as well. So that's basically my story. I just want to mention something. When we were diagnosed with cancer, we feel that it's me, it's my journey, it's, I'm the main mana. But when I came out of hospital, I was at home, and my mother-in-law and my in-laws came down to visit for the Sunday lunch. And when they left, I said to my wife, I'm dying, and none of you have got the guts to tell me. And she said, no, it's not that you're dying. It's I need support. And it's something that we don't often think about, is the support of our partners and our other people. And what Prof. Michael said about speaking to people to be yourself is so important, guys. It really is. And you do lose friends because they don't know how to handle the situation. They don't know what to say to you. They don't want to offend you or something like that. But you pick up many new friends, great friends.
I think that's incredible, Bobby. And I think something that comes up so often is the role of the caregiver, because if you just think earlier, again, what David even said, the role of his wife, the role of his family, his children, and I think like we know in the work that we do, a cancer patient that has a supportive family around them, if it's a partner or family members or even close friends, we know they cope better compared to when they are isolated and feel alone. And I think, yeah, I think you've been so brave. And I think obviously having such a terrible fear of needles obviously just also affected like your whole treatment, like a process and protocol. But I think the fact that the doctors and stuff were able to work through that is actually, it's actually quite incredible. But I think if you look at those anger issues, I think that's actually what a lot of men go through. And I think it's because men, and I think as Prof said also, it's hard for them to talk because you are now sick and now you can't be the man for this period, and you can't maybe bring in an income, and you can't maybe have sex, and you actually can't be the normal man that you were, as you said, for this last year of your life. You are someone else trying to heal and heal yourself, but it's almost like you're unrecognizable. And I think it's these emotions that are not spoken about that can really cause almost that anger and that kind of like rage that men actually experience. So in terms of counseling and support and speaking out, Bobby is actually also on our, he also assists us with a lot of counseling with parents and as well. What is your take on that, Bobby? And what would your encouragement been to men that are maybe a bit skeptical about counseling and like, ugh, you know, like I don't need it, I'm fine. Like, what is your take on that?
You know what? We're not all strong. We're macho men, but there comes a time in our life when we need a little bit of support. And when we're going through treatment, if there's support there, grab it. Don't stop your treatment. Don't think that you're too strong, because you're not. Forgive me, I see it a lot with what I'm handling at the moment, where people start treatment and they say, you know what, I wasn't as sick as I am now that I'm on treatment, so we stop treatment. Don't stop. Push it through. You can make it. You will make it. And look for the funny side of life, because we need to have a good laugh every day. Believe me, it's good medicine.
It definitely is. So I think, Bobby, what is your take-home message for everyone today? What is one thing here that you'd love the incredible amounts of men? I'm just going to double check now. I think we're on a combined total of, we've been bouncing between 196 people for the whole entire session, which is quite incredible. What is your take-home message, Bobby, for the wonderful people that have taken the time to join us today?
You guys, remember, cancer is not painful when it starts. If you see something different on your body, check it out. It doesn't mean it's cancer, but take control of your body, check it out. You owe it to yourself if you feel you don't owe it to anyone else.
Thank you so much, Bobby. I think I'm always so grateful for your openness and your honesty and just for sharing. And I think it's just as Paul said in the beginning, it's such a vulnerable time in your life, and I'm so grateful that you were willing to share with us today. I'd like to also thank David and Prof. Michael for their time as well. And now I'd like to go through to any questions. Lucy, are there any questions that you'd like us to address? I see some comments, but are there any questions that anyone would like to ask or put in the chat box?
Cara, we don't have any questions, but we've had some wonderful comments. And a big thank you to Bobby and David for sharing their story and being so vulnerable, but also showing their resilience and being opening and helping men to open up and share. So thank you very much. And also we have shared that on our website, we've got lots of warning signs and links that can show you about the risks and the symptoms, and also any support mechanisms or any support platforms that we can offer you. So I think what would be really nice would be one more question to actually ask about the risks, the familial risks. I think maybe, I don't know if Michael left us, or, you know, how important it is that the family risks. I think that's an important thing you and Bobby could cover. Yeah,
so I think definitely in terms of prostate cancer specifically, there's number one, familial risk is huge. If it's in your direct line, which means like dad, uncle, brother, grandfather that you know has had prostate cancer, you need to encourage your brothers, your other uncle, your you know what I mean, whoever it is that in that family who has not been tested from as young as the age of 40, you need to advise your GP that my dad does have prostate cancer and I would like to have an early PSA test done, just because that could be the difference between a very early detection and someone who is diagnosed late. I know with my dad as well, as you know, that's what I said in the beginning about the woman nagging. My dad's gonna go for his PSA. He was 63, and I took him to the office one day, and I'm like, "You're coming with the nurse. Vanita's gonna screen you, and I'm gonna pay for it then because at least I'm gonna get it done because you're refusing." Tender age of 63, probably had flu only once a year. Nothing wrong with him his whole life, and there we go, prostate cancer. But early enough to be okay now. He's 75. He says he's 3/4, still driving me absolutely mad, but fantastic and healthy and well. And do you know what I mean? I think that's the thing. It's like we have to push people we love. And I think if you just think what Bobby said earlier, which it always hurts me, Bobby, and you know, I've seen women like this when we've had clinics and screenings on community level that are presenting to us, and they come in the mobile unit and they're coming for that examination from the nurse, and then we are seeing an oozing nipple or something, or they pull us aside in a community and say, "Look here," and there's a big misconception that it's just possibly like the lower class of the communities that are experiencing this, and it's actually not. We have high profile professionals that are very well educated in accounting but have no knowledge of cancer, what to look out for, and therefore that well-to-do person is technically behaving as someone that's poverty stricken with no knowledge, because the connection is no knowledge of cancer, no knowledge of signs and symptoms. So there's like no like correlation between, and we always say in South Africa, racism is a huge thing for us. And we always say cancer is a non-racist. It doesn't care. It's children, it's adults, it's all races, it's all colors. You know, in terms of some of our children's services, the youngest child we've served in our Steve Biko facility is 27 days old, which is absolutely frightening. So cancer is unfortunately, it doesn't have a preference. It's just affecting a lot of people. And when you love someone, it's really hard that they have cancer, a family member, a loved one, or even a friend, as Prof was speaking about earlier. So I think the closing message from us as CANSA is that thank you for joining us. Thank you for taking the time. I know you guys all have busy schedules. You guys aren't one of the, well, actually like the best distribution company in the world for nothing. I know you all work really hard. Stan keeps telling us how you guys all work so hard, and you obviously use professionals, and you have such a high standard of quality and care. And I hope that the high standard of quality and care you put in your business and in your products and in delivering the best service, you will also give that same high quality of deserving care to yourself. So use all your company lovely sayings and stuff on yourself. Okay, that high quality, please use it on yourself, because you deserve the same. You also deserve the best from yourself. So please take care. We are so grateful for this opportunity. Please, you can go through Stan if there are any queries or any more support things we can offer you. But thank you, take care, and I'd like to hand over back to Paul. Thank you so much, everyone.
Thank you very much, Cara. Thank you. And thank you to our wonderful panelists for sharing some deeply personal stories and journeys with us. We know that it's tough for men to ask for help. We battle even to ask for help with directions, never mind help with our healthcare. So we really appreciate the advice that has been given today. There's been some incredible advice, wonderful stories from Mr. DHL himself, David Lucas, and Prof, and of course, Bobby Ware. It's been an absolute pleasure having all of you. I kind of think I need some of your shut up pills every now and then, Bobby, as well. Might help me. But also there's been some incredible links that have been provided. The Men Supporting Men's group, I fully endorse it. If anyone, and just for the panelists, I went around the room. There's people on the call today from DRC, from Nigeria, Malawi, Senegal, Ghana, Reunion, Uganda, South Africa. So an incredible representation from across Africa have been here today. And so we thank you for your time. We thank you for your advice. And certainly to those on the call, if there are any issues, please reach out to your local HR, head of HR, who can help you. And of course, what we'll do is also put up some of these links. It's one of the benefits in the digital age that we can join these Zoom calls from anywhere in the region. So we'll put up those links. Stan will send them out. And again, the core message is really prevention, early detection is really the key to prevention. So we want to encourage you all, take your time, go and make sure that you do the screening, because in the long run, it can save your life. And so thank you very much to everyone who took time out from work. Thank you for our panelists. Thank you to Cara and to all the folk at CANSA behind the scenes, Lucy and Jacques, and just wishing everyone continued health into your future. Keep safe, do your testing, and thank you for your time. Thank you very much.
Hi, it's Tony.
Sign here.
Mr. Sitole? Ready for your blood test?